Welcome to the Deep Dive. Today we're diving into real-life use cases for AI in healthcare. It's a book by Dr. Saurabh Bhatia.
That's right. And if you're listening and you're maybe a healthcare software developer or you work in a hospital, a provider system, maybe even insurance,
Uh-huh.
then this conversation is really for you.
Absolutely. We want to explore how this book, its ideas, could genuinely shift how you think about using AI, how it can really revolutionize your approach to improving patient outcomes, efficiency, the whole system, really.
Exactly. Dr. Bredia brings this interesting perspective because he understands both healthcare and AI deeply. He's not just talking theory here.
No, it feels very practical.
It is. It's about moving past the buzzwords to actual applications, things that can make a real difference day to day.
What I liked was how he structures it. Did you notice? He calls it a layered cake.
Yeah, I did see that. It's a good analogy.
Right. You start with the more foundational stuff, maybe easier wins,
Mm-hmm.
and then build up.
Build up to the more complex, data-intensive applications.
So our mission today really is to pull out those key insights, the things that are most relevant for your work, listening in, and hopefully spark some, new ideas.
Definitely. So that first layer, part two of the book, he calls them accessible implementations.
Accessible. I like that. It sounds less intimidating.
Well, that's the idea. These are often things you can integrate more easily, maybe alongside systems you already have. Opportunities for, let's say, quicker impact.
Okay, let's unpack that first layer then. It starts with OPD support, outpatient department stuff,
Right. And straight away, you see things tackling really common frustrations.
like smart appointment scheduling. That jumped out at me. Could that finally fix the waiting game?
Well, think about it from the hospital or provider side. AI can chew through tons of data, past appointments, who shows up, who doesn't, even real-time things.
hmm
And instead of just a fixed schedule, it predicts no-shows, optimizes the flow. It becomes dynamic.
So for you developing scheduling software, that's a totally different way to think about the problem. Not just booking slots, but managing flow.
Precisely. Maximizing resources, improving patient experience. It's a win-win.
Then there's automated patient triage. This feels relevant for anyone building patient portals or initial assessment tools.
Yeah, and the key here is it's not about replacing clinicians. It's about guidance.
Guiding non-critical patients.
Right. Based on their symptoms, guiding them to the right place, maybe telehealth, urgent care, whatever's appropriate.
Which, for a hospital system, takes a huge load off the ER and primary care docs, doesn't it?
A massive load. Those AI symptom checkers can be that smart first point of contact.
Okay, another big one for efficiency, especially thinking about providers burning out. Voice-to-text documentation.
Oh, absolutely. He even mentions the tools he uses himself, like Super Whisper, Murmur Type.
Right. Imagine if clinicians could just talk and the notes get generated accurately. How much time would that save?
Hours and hours. And for you software developers, the real opportunity is building this into the EHR systems seamlessly.
So it's not another separate tool they have to juggle.
Exactly. Saves time, captures richer info maybe, improves record accuracy because it's happening in real time.
Medication reconciliation assistance also seems like a critical safety feature,
It really does. If you're developing prescribing software, think about building in an AI that flags potential interactions, allergies, contraindications automatically.
like a safety net.
A powerful safety net. It cross-references massive drug databases against the patient's history instantly. Think about the errors that could prevent.
For providers, that's peace of mind. For insurers, that's potentially fewer adverse events, lower costs.
Everyone benefits from fewer medication errors.
And the last one in this OPD section, follow-up recommendation systems. This feels key for continuity of care.
It is. For hospitals trying to ensure patients don't fall through the cracks, AI can look at the diagnosis, the treatment, and suggest the optimal follow-up schedule.
Moving from reactive to proactive care.
That's the core idea. Software incorporating this could automate reminders, help schedule those follow-ups, maybe even personalize them based on risk.
Which could reduce readmissions.
Yeah. And improve long-term outcomes. Again, beneficial for providers, patients, and payers.
Okay, still in part two, he shifts to PG preparation, postgraduate medical education. So if you're developing edutech for healthcare.
Right, there are some really interesting applications here. AI generating practice questions, for instance.
Like an AI quizmaster.
Sort of, but
Hmm.
also identifying specific knowledge gaps for individual students. AI is a diagnostic tool for learning itself.
And optimizing study, like space repetition.
Exactly. Using AI to figure out the perfect timing for reviewing material to maximize retention, even predicting performance on exams.
Wow. And virtual study groups. AI-enhanced collaboration.
Yeah, and maybe the most interesting one, standard patient interaction systems.
Simulated patients.
Yes. Think about medical students interacting with an AI patient showing specific symptoms. The AI gives feedback on their questions, their reasoning.
That bridges the gap between textbook learning and actual practice, doesn't it? In a safe space.
A huge gap. So for you developers in that educational space, creating these realistic adaptive simulations that give useful feedback that's incredibly valuable, it builds better clinicians.
Definitely a powerful training tool.
Hugely powerful.
Okay, now Chapter 4 was interesting. AI wrapper applications using LLMs, large language models. This sounds very relevant for software developers wanting impact without maybe a total system overhaul.
You absolutely hit on it. LLMs acting as like translators or assistants for data you already have.
Give me an example.
Okay, prescription analysis. Imagine a patient scans their prescription with a mobile app, maybe linked to a pharmacy system.
Using OCR, right, optical character recognition.
Right, turns the image into text. That text goes to a cloud-based LLM. And here's the key insight for you developers. The LLM explains it all back to the patient in simple terms.
What the drug is, the dose, side effects.
Exactly. Clear, understandable language. Think about the impact on medication adherence, reducing errors.
That's a direct patient benefit, which providers and payers care deeply about too. And the tech stack he describes sounds achievable.
It's becoming much more feasible. And think about the insurance angle, better adherence. Fewer errors means lower long-term costs. It connects.
Makes sense. And the same logic applies to lab report interpretation, translating jargon into plain English,
Yes, empowering patients to understand their own health better. That drives engagement.
which is a huge goal for so many healthcare systems, patient engagement.
Absolutely. And then there's simplified discharge instructions. Personalized, maybe multilingual, especially thinking about somewhere like India with its diversity.
That feels like truly patient-centered care. Clear instructions, culturally sensitive, maybe via an app, that could really cut down readmissions.
Which is a major pain point for hospitals and a cost driver for insurers. So software solutions here have real value.
The book also mentions using LLMs for summarizing medical documents for doctors, Q&A assistants using medical knowledge, even helping generate clinical notes or explore treatment options with patients.
It shows the versatility of LLMs, doesn't it? These wrapper applications kind of enhance what's already there, making information easier to access, tasks more efficient.
So for developers, it's a lower barrier to entry for AI, perhaps, but still delivering significant value.
I think that's a fair assessment. Value for providers, patients, the whole system.
Okay, so that was part 2, the more accessible stuff. Part 3 then ramps up the complexity a bit, right? Looking at enhancing clinical workflows, data integration.
Exactly. This is where hospitals and larger provider networks might see more fundamental operational shifts.
Chapter 10 gets into hospital internal processes, things like AI-powered staffing optimization.
Yeah, moving away from just reacting to needs and towards predicting them, analyzing patient volume, acuity, staff skills to optimize schedules.
For hospital admins or those building HR or operational software for hospitals, that's a game changer compared to manual scheduling.
Totally. And smart building management using AI to optimize energy resources, that hits the bottom line and sustainability goals.
Plus, patient flow optimization, using AI to unsnarl bottlenecks and cut wait times inside the hospital.
Which directly impacts patient satisfaction and throughput.
Chapter 11 digs deeper into resource management, operating room scheduling. He calls it the symphony of the scalpel.
Yes. But it's critical. Efficient or scheduling maximizes use of incredibly expensive assets, reduces downtime. That's revenue and access.
And predictive bed management, knowing where beds will be needed.
Crucial for flow, reducing ER crowding. He calls it, where will everyone sleep tonight? It's about anticipating needs.
Also equipment tracking, knowing where everything is, and matching staff skills to immediate needs.
All about having the right resources, people, places, things in the right place at the right time. AI providing that sort of digital sixth sense for operations.
And Chapter 12 is cost center optimization, turning data into dollars, basically.
Right. For the CFOs or anyone developing financial or cost management software for healthcare, AI can analyze why procedure costs vary so much.
Find those drivers. And optimizing supply use, reducing waste.
Absolutely. Or identifying why some patients stay longer than expected, finding those non-clinical barriers to discharge.
Predicting resource needs for incoming patients, too.
Basic models, yes. And even optimizing the revenue cycle, things like claim scrubbing, predicting potential denials, helping the financial health of the organization.
Which leads nicely into Chapter 13. Insurance claims processing, an area everyone knows can be complex.
Understatement. So AI for automated prior authorization, streamlining that bottleneck.
Or claim denial prevention, flagging common errors before the claim goes out.
Exactly. And fraud detection, spotting those suspicious patterns. For insurers or developers building tools for them, this means huge potential savings in admin overhead and faster payments.
Right, it just makes the whole process smoother, more efficient.
Definitely.
And part 3 keeps going, discharge planning, post-discharge care.
Yeah, like remote patient monitoring analyzed by AI, virtual nursing assistance for common questions.
Even using computer vision to track rehab progress, and optimizing ambulance dispatch and routing for pre-hospital care.
It really covers the whole journey. What's striking is how interconnected it all becomes with AI.
So if you're developing broad healthcare platforms, the vision is this seamless, proactive continuum of care enabled by these different AI tools working together.
Precisely. Predicting readmission risk, enabling early interventions via remote monitoring, ensuring faster emergency response. It all ties together for better outcomes and efficiency.
Okay, so finally, part 4 takes us into the advanced applications, high-impact stuff.
Yeah, the really complex, often high-stakes areas, like intensive care unit, the ICU.
Where you have tons of real-time data.
Exactly. So AI predicting things like hemodynamic instability, giving clinicians early warnings, or predicting the risk of ICU readmission for patients being transferred out.
For anyone developing critical care monitoring systems, these are potentially life-saving applications.
Absolutely. Or AI guiding sedation management for better patient comfort and recovery.
Then there's genomics and personalized medicine, Chapter 26. This feels like the future, really.
It does.
Yeah.
Using AI to sift through massive genomic data sets to pinpoint disease-causing variants more effectively.
Or predicting how a specific patient will respond to a drug based on their genetic markers.
Tailoring medication, and AI driving the selection of personalized treatment plans like a sophisticated GPS for health.
Accelerating rare disease diagnosis, too, by combining genetic and clinical data.
It's becoming essential for making sense of genomic complexity and turning it into useful clinical insights. This is foundational for truly personalized medicine.
So for biotech, pharma, and the software developers supporting them, this is where cutting-edge AI development is happening.
Without a doubt.
And the last chapter we'll touch on, 27, looks at commercial opportunities, particularly linking AI treatment plans with the FHIR standard.
Right, FHIR, Fast Healthcare Interoperability Resources, that standard for exchanging health information electronically.
So the idea is FHIR-compatible marketplaces for AI-driven treatment plans, like an app store for medical protocols.
That's the vision. It opens up huge possibilities for developing, validating, and deploying these AI innovations much more widely. Interoperability is the key enabler.
For entrepreneurs and developers in health tech, that sounds like a really interesting frontier.
It certainly could be. Platforms for AI-powered clinical trial recruitment, localizing global AI protocols for specific regions like India.
Adapting them. And even outcomes-based pricing models, linking payment to actual patient results achieved with AI help.
Lots of commercial potential built on these advanced AI applications.
So, wrapping this up, stepping back from Dr. Bhatia's book, the message seems clear. AI isn't just hype or some distant future thing.
Not at all. It's here. And the potential to genuinely reshape healthcare delivery and management is immense.
And for you listening, whether you're deep in software development, running hospital operations, managing provider networks, or working in insurance, this book really lays out a practical roadmap.
It does. It shows how AI can be applied strategically across the board to boost efficiency, improve care, drive innovation in your specific area. It's about changing how you think about tackling problems.
It really challenges you to see where AI fits into your world.
Exactly. The opportunities are vast.
Now, of course, implementation isn't trivial. You need to think about data quality, infrastructure, getting users on board, cost, change management.
And critically, especially somewhere like India, things like multilingual support, low bandwidth environments, affordability, digital literacy. Plus, integrating with national initiatives like ABDM.
And we absolutely have to mention data privacy and security. Regulations like India's IT Act and the Digital Personal Data Protection Act are paramount.
Non-negotiable. And the ethics, algorithmic bias, fairness, transparency. AI has to be an aid to human judgment, not a replacement for it. Human oversight is crucial.
Always. But the potential is undeniable. The future of healthcare looks increasingly intelligent.
And the insights from Dr. Bhatia's work really offer you a chance to be part of shaping that future.
If you want to explore the book further, Dr. Bhatia's contact details are in the show notes. Email is support@tsmls.org, and there's a phone number for CUNY India too. +91 787 5564 932. Maybe reading it could be the spark for your own AI revolution in healthcare.
It's definitely worth considering.
Thanks for joining us on the deep dive.
Thank you.